can cause this uh, hepatoma or liver cancer because it doesn't have a vaccine. Hepatitis due to alcohol. Hello, I am Dr. Ullas Vaidya. I am the lab director of Dr. Vaidya's laboratory. I started this laboratory in 1979 and I had opportunity to serve the people for nearly 44 years now. Those days, there were no social media, and now the technology has changed, and it gives me opportunity to interact with many people and inform you about various uses of pathology laboratory, various uses of tests, and that's why I'll be talking to you. Hepatitis is swelling of liver. The elements of liver are normally divided into three parts: hepatic, intrahepatic, or prehepatic. Now today for hepatitis, we are discussing hepatic or liver diseases. Liver is swollen or inflamed due to various sort of agents. These may be viruses, this can be even chemicals, this can be anything. For example, alcohol. Now the common hepatitis what we will discuss is infective hepatitis as well as hepatitis due to alcohol, and also there is a hepatitis called as NASH, non-alcoholic fatty hepatitis. So infective hepatitis are generally caused by viruses, and these viruses are classified as hepatitis A, B, C, D and E. Now in these viruses, especially hepatitis A and hepatitis E are waterborne diseases. So this can infect any human being whenever there is a contaminated water. This can be contamination due to sewage, and especially in rainy seasons such epidemics break up and one can get hepatitis A or hepatitis E. This can be diagnosed in the laboratory by a specific test, and these are normally self-limiting viral diseases, but sometimes they can be fulminant also. But hepatitis B and hepatitis C are actually viruses which are passed by injury to the body, somewhere breakage of the epithelium, and therefore they can be caused when there is a infected needle, which can occur in drug addicts, or it can be bloodborne, or it can be due to by mistake using brush or razor which is infected, or even due to sexual transmission. So this happens in cases of hepatitis B and hepatitis C. So therefore, hepatitis B and hepatitis C are bloodborne infections and they need to be avoided, especially hepatitis C because it doesn't have a vaccine. But hepatitis B has a vaccine. So hepatitis B vaccine one must definitely take so that we can prevent this disease. And it is a dangerous disease. It's a very highly infective disease. If somebody comes across a hepatitis B virus, it immediately gets in body and causes damage to the liver. It can cause chronic hepatitis also in many cases, and this can lead to ultimately a cancer of liver. So therefore, hepatitis B is a preventable disease and it must be avoided by taking immunization. It is to be given in 3 doses. First dose after 1 month and after 6 months. But this needs to be again, this immunity must be boosted by booster dose. So this is regarding hepatitis B. Hepatitis C doesn't have actually any such vaccine at the moment. So hepatitis C is also a very bad disease and it has a similar course. It causes cirrhosis and chronic hepatitis cirrhosis, and then at the end it can cause hepatoma or liver cancer. So all these things must be taken care of to avoid unfortunate problems of cirrhosis and cancers. So for preventing hepatitis, what we should do? For example, for avoiding hepatitis A and hepatitis C, use good hygienic conditions, have clean water, pure water, so that you will not suffer because of these diseases. For hepatitis B and C and D, you should not have infected things of a hepatitis person in use. We should not see that means needles are always disposable, which nowadays every doctor uses disposable needles. Blood and blood products are screened for hepatitis. Here I would like to mention one thing, that even though the blood products are mentioned by routine ELISA test, there is always a chance that the particular donor can be in a dormant stage, in a window period, and the virus may not be detected by the your ELISA test. So therefore, there is a special test called as nucleic acid testing (NAT), which tells us by molecular method whether the virus is present in the blood or no, and it is always advisable to have that testing in case of blood transfusion. So you will immediately know that that particular blood is infected. So these are the all precautions all of us should have. Alcohol should not be taken. Similarly, obesity should be controlled by using diet, exercise, and if required, certain drugs. And with all these things, I think we can avoid hepatitis, which is a bad disease. And today, I wish that let us have hepatitis nirmulan from our country. Thank you.